Dozens of people in Whangarei are in quarantine tonight after confirmation of another case of measles, bringing the total number in Northland to 5. The latest has forced a daycare centre to close its doors. The child infected with the highly contagious disease went there. The preschool, which is not being named, employs more than a dozen staff and cares for about 60 children. And up to 20 people may have also been exposed to the illness at a medical centre. Those who aren't immunised or can't prove they're immunised are being asked to go into isolation. Northland DHB's Medical Officer of Health, Dr. Virginia McLaughlin, says that it's forced many at the daycare centre to stay home.
The daycare has decided to close, mainly because they haven't any staff at the moment really available to provide care to the children.
Because of the isolation issue?
Yeah, because they're unable to provide us evidence that they've got immunity to measles, and because they've been exposed to a case that will have been infectious while they've been at that daycare, we have to be clear that they may go on to develop measles, so we can't put other people at risk.
So obviously we're coming up to a holiday weekend here, and people may have had plans to, socialise, go away, etc. Are you confident that the message about staying isolated is being heard by everyone involved here?
Yeah. I would like to think that if the public health nurse team has contacted people and asked them to exclude, they will do the right thing. Because the reality is, if you've been asked to stay in isolation, it's really important that you do so, because that ensures the rest of our community are protected.
So other than the daycare centre, what other people are you tracing? Did this child have contact that spreads far and wide?
We're contact tracing for this particular case 3 main groups: the family, the daycare, and also the medical practice involved. And I guess that we really need to reinforce to people, if you have a rash and you think it might be measles, please phone ahead. Please let ED, please let the medical practice know, so you don't actually go into the waiting room area. Because if you go into the waiting room area and you have the rash, you'll be infectious, and then potentially you're going to expose other people to the measles virus.
So was this child in the waiting room at a clinic?
Yes.
How long for?
I can't tell you the exact time frame.
And potentially how many contacts did they have with people while they were waiting?
There would have been more than 20 in that situation. Our general practices are very busy, as you can imagine.
Is the immunisation message getting through?
Well, unfortunately, I don't think it is, to be quite honest, because we've been putting messages out for several months now about the importance of being up to date with vaccinations. And for whatever reason, I guess some people are definitely doing the right thing, and we say thank you very much to them, but some people aren't.
And why aren't they? Is it a choice mainly, or is it not having the information available to them?
I don't know. That's the question. Maybe you could ask our public and find out.
So the child that is infected, had they had any of their immunisations?
Yes, this child has had 1 MMR.
So was not fully immune?
No.
You said that this is the 5th case, and you are looking at whether there are any links to the others, and at this point you can't see a link. So where do you think this child became infected?
Well, that's what we will have to, continue to review. So I can't really comment on that at this point in time.
That leaves you a little bit exposed, doesn't it, if you don't know where they caught it from?
Well, I think the thing is, at the moment, we look through, it's understanding the epidemiology of the situation. We have a case, we really try and strictly contact trace around that, and the people that we identify as immune, we isolate. And then we see if there's another case. If there's another case, then we map around that, and sometimes we can find a link, whether there's been a common exposure. And we just keep working on like that. If we do our job really, really well and we're supported by the public in the isolation, well then we may have additional cases in the people that we've already identified. And that's a really good thing because we've already got them isolated, so they're not, walk about in the community while they're infectious.
And that is Dr. Virginia McLaughlin, who is the Northland DHB's Medical Officer of Health. Now, the daycare has to wait until June the 7th to find out if it's in the clear, and the medical centre has to wait a few days later, and on about June the 10th, they will know whether or not they are in the clear too.